All right, everybody. Today we're going to be talking about adrenal glands. I'm Dr. Serena Satcher. Welcome to Treat Yourself to Health. And in my practice, most of the people when they come in are having problems with adrenals. It could be that the adrenal glands are out of sync. They're not on a circadian rhythm. But we're going to talk about a little bit about that today. So adrenal fatigue one-on-one. So adrenal fatigue was, this terminology was coined by Dr. James Wilson. It was explained as a collection of related symptoms caused by insufficient adrenal gland function. In other words, when the adrenal glands, which sit on top of the kidneys, by the way, they look like little hats sitting on top of the kidneys, and you have two of them. Fatigue can arise if those glands are not functioning at their optimum. And unfortunately, in conventional medicine, as long as they see that you're producing cortisol in the normal range, they are not going to be concerned. We are more concerned in functional medicine because we are looking at a certain pattern of secretion of the adrenals. So just because they told you in conventional medicine that you basically don't have a disease that they can diagnose, then that doesn't mean that you're not having some issues with the adrenals. People may have issues with the adrenals and have problems sleeping. They may also have fatigue. They may also have problems with energy during the day, especially in the middle of the afternoon when there are insulin resistance problems. And let's talk about what the adrenals do. So the adrenal glands, like I said, they sit on top of the kidneys, and the adrenal cortex, which is the middle part of the adrenal glands, it makes certain hormones that are essential for life. It makes cortisol, and aldosterone, and those hormones have to do with regulating your blood sugar, your metabolism, your immune system, your stress response, and aldosterone helps with blood pressure control and with cardiovascular or heart and vascular system issues. The adrenal medulla is another part of the gland that makes non-essential hormones. So it's said that these hormones are not necessary for life, but I don't know who determined that, because all the hormones your body makes are necessary for life, but they may not be, it may not be life-threatening like the cortisol is. So it may cause problems over time, but not be immediately life-threatening. The sex hormones are also produced by the adrenal glands, like estrogen and progesterone. And there are neurotransmitters such as dopamine, norepinephrine, epinephrine, and there are also other chemical messenger hormones that are produced in the adrenal glands. So there are certain symptoms that we might see with fatigue, such as, or adrenal sluggishness is what I'll call it. People may have persistent and nonspecific fatigue, so they don't know why they're tired. They may struggle getting up in the morning. It may be tied to some thyroid issues. They tend to go hand in hand. Energy levels can't be sustained during the day. They can have difficulty handling stress. They can have food cravings, particularly for salt and sugar. Weakened immunity, unexplained body aches and joint pains, depression and anxiety, dark circles under the eyes. So stress, we need to have stress occasionally so that our body can exercise how to react to stress. So we call that resiliency. And so But when we're too much in fight or flight, which is a sympathetic nervous system kind of being out of order or out of range, and it has to do with certain neurotransmitters that are stimulating, like adrenaline. So if we're too much in that phase, then that can stress out or kind of fatigue the adrenal glands. So, you know, we say some people are sick and tired. They're sick and tired of being sick and tired. So sick and stressed. There can be infections, chronic inflammation, hormone imbalances, poor nutrition or nutrient poor diet, lack of sleep. Stimulants like caffeine can kind of burn out the adrenals. And caffeine can be in tea, coffee, chocolate. Work-life imbalance. Oh, and I forgot about caffeine in some of these drinks like Bolt. So there are also caffeinated soft drinks, is what they call them. Overtraining physically, which I find that some people just, they have a hard time recognizing that this is a problem. And they may be a little bit addicted to exercise because they feel like they're going to lose weight if they exercise, but sometimes we're over exercising and that can cause you to gain weight because it's causing inflammation. Sounds weird, but I see this a lot. So I mentioned the adrenal thyroid connection. So when the thyroid is not working properly, it can throw the adrenal glands off, cause fatigue, depression, weight gain, muscle aches, brain fog, low libido. So we look out for this. We generally are going to check for thyroid function because it's so common to have abnormal thyroid function and thyroid dysfunction. And so a lot of times this goes undetected and people are gaining weight and they don't know why, or they're having trouble waking up in the morning. So thyroid testing includes a measurement of the hormones, thyroid panel, looking at both T3 and T4, reverse T3, sex hormone binding globulin, leptin, which is a satiation hormone, looking at tissue levels of thyroid hormone, and also looking at the sex hormones too, because if someone is in menopause, that can cause thyroid dysfunction too, and it can add to the situation. So when people are losing hair, is another indicator that they may have some problems with the adrenals. It may be tied to thyroid, it can be tied to both. Unexplained weight changes, low blood pressure, unstable blood sugar, blurred vision. These are other signs. Infertility. The most diagnostic tool for adrenal testing is the cortisol saliva test. We usually get 4-point measurements, but there are other hormones that we may check, neurotransmitters, looking at the blood pressure and whether there's a change in the blood pressure when the person goes from sitting to standing. And all those various tests are necessary to really pinpoint it. And there's certain phases of adrenal fatigue. So stage 1 is the alarm reaction. Stage 2 is a resistance response. Stage 3 is adrenal exhaustion, and that's when you see the line on the graph kind of going flat. And adrenal failure is when you're down to 0, and that's really Addison's disease. So when you go to conventional medicine, you either have to have Cushing's, which is the cortisol is way up there, or you have to have a flat line at the 0 line, which is adrenal failure. And that's Addison's disease. The in-between is what we're referring to in functional medicine, although I have diagnosed some people that were in that Addison's range. Sometimes people have autoimmune disease for years and years, and they're seeing conventional medicine, and they're getting treated with steroids, which can cause the adrenals to have more difficulty adjusting and more difficulty resilience in getting back to normal. So let's talk about the alarm reaction a little bit. So it's the first stage of adrenal fatigue, and it's a fight or flight. And it's characterized by high cortisol levels, but they're not high enough to be diagnostic of Cushing's disease. And the body initiates an anti-stress response to overpower the stressor and begin the production and release of cortisol. There's very little physical or physiological dysfunction noticeable on physical exam. So the fatigue is kind of mild and it may not sustain throughout the whole day. The sleep patterns are disturbed, and this can actually be associated with sleep apnea. And a lot of times we start diagnosing sleep apnea by seeing a spike in cortisol in the morning. Because what happens is people's cortisol is high throughout the night. That causes the blood sugar to be high throughout the night. And a lot of people say they're wired but tired. So they feel tired during the day, but then at night when they try to go to sleep, they feel wired and they can't go to sleep. And during this stage, you can have elevated adrenaline or epinephrine, cortisol, DHEA, and insulin will be in higher amounts, the fasting insulin in the morning. Stage 2, the resistance response, is where the adrenals begin to lose their ability to keep up with the body's demand for cortisol. Fatigue becomes more noticeable and extends beyond the morning, afternoon, into the evening. And the body will need more rest than usual to recover and will very rarely feel refreshed for sleeping. It can also be the result of infections, insomnia, anxiety, and irritability become more common. There's substantial drops in important hormones such as DHEA, testosterone. What happens is the cortisol increasing production from the adrenals. The adrenal will have to use the ingredients for hormones to make the cortisol instead of the other hormones. So it'll take it away, and that'll cause the other hormones to drop. So number 3 is adrenal exhaustion. And this is when the body recognizes the decline in cortisol output and focuses on conserving its energy for survival. To do this, the body begins to slow down and break down existing muscle tissue for energy. Chronic fatigue is common. There's reduced exercise tolerance. There's longer recovery time, brain fog, insomnia, depression, increased infections, weight gain, a lack of sex drive, less productive during the day, and there's an increased need to rest. At a certain point during this phase, people can kind of crash and burn, especially when they've been in this mode for a long period of time. And as I said in the last phase, the stress hormones, sex hormones, and neurotransmitters can crash. And then we have adrenal failure. So this is when people are flatlining, and the flatlining can go all the way down and become Addison's disease when it goes down to the 0 line. But we see flatlining often, and most people are not at that Addison's level, but we do see it often. And some people are going to have pain in the lower legs and the back and the abdomen, and they have digestive distress, such as vomiting and diarrhea, severe dehydration, low blood pressure, loss of consciousness, high risk of cardiovascular collapse. So the adrenal solution. So the solution, there are plenty of ways to reverse adrenal fatigue. Some include dietary changes, adrenal supporting supplements, reduce adrenal stress, minimize exercise, increase rest, a regular sleep schedule, detoxification, adequate hydration, heal existing infections, practice meditation. And a supportive adrenal diet includes healthy fats like coconut oil, like avocados, olives, grass-fed butter, fatty fish, grass-fed meats. And from vegetables, we need to get the B vitamins and vitamin C's, fermented foods for their probiotics, and protein, especially in the morning. It's recommended to consume 40 grams of protein in the morning to provide support to the adrenal throughout the day. And exclude caffeine, sugar and sweeteners, starchy carbohydrates, processed foods. So the role of blood sugar, as I stated before, there can be imbalances in the cortisol that will affect the signaling to the liver to take the complexes of carbohydrates from the liver and make sugars. And when the levels are high, this gets triggered too often, and this will cause the insulin to go high, and you'll have a high blood sugar. So it's important to address the blood sugar stability to help with the adrenal fatigue. And we need to address dangerous deficiencies of nutrients like vitamin C and B, and especially D, which is very common, magnesium, and probiotics, like I mentioned. It's important that people get restful sleep. So sometimes we have to supplement for things to kind of calm down the adrenals during the night, or things to regulate it during the day so that people do feel sleepy at night. And you should be aiming for 7 to 10 hours of sleep at night. So it's important to speak to the doctor and coordinate some type of program, and it may involve multiple things to get this under control pretty quickly in the beginning. Stress management. So there are lots of things that we can do to manage stress. Things like using lavender and essential oil, practicing mindfulness meditation, beginning a yoga practice, deep breathing, qigong, tai chi, listening to enjoyable music, relaxing with a good book, drinking some tea with like a tulsi tea with holy basil or with a chamomile, and going outdoors and connecting with nature, putting the bare feet and bare hands into the soil is grounding and helps you to get negative ions. Going out into the forest or forest bathing helps you to get negative ions. Also, going to the ocean side can help you to get negative ions from the ocean. Get a massage. Excuse me. So there are many resources that you can access online. You can go to CDC, you can go to mayoclinic.web, you can go to my website at Treat Yourself to Health. And I actually have a store, and you can type adrenal in the store and a lot of different supplements will come up. You can also go onto my blog. I have some things about fatigue on my blog. And thank you for coming. I'm so glad that we could spend this time together talking about the adrenals. And there's so much to know about the adrenals. I don't expect for you to understand everything, but I hope you got some takeaways here, and you can rewind this and talk and listen to it again, because I know I was talking fast. I'm trying to keep people's attention because some of us lose attention after 20 minutes, and we're on minute 25 here. So, all right, have a great evening. Please post any questions you have in the messaging system. I'm happy to answer. Thank you.